Okay, everyone, it's 10 o'clock, but we're going to give it another minute or two to allow others to join. Then we'll get started. Thank you.
I had to switch my audio. Can everybody hear me fine?
Sure can.
Okay.
Okay, it's 2 after 10. We're going to go ahead and get started. I would like to extend a warm welcome to everybody today to this Medicare workshop. This is I believe, the first Medicare workshop we've had in quite a long time, and it is being presented to you and sponsored by the Wyoming Primary Care Association. And so we're going to be hearing from a presenter from CMS, Renee Martinez, in just a few minutes. The title of her presentation is Understanding Medicare. And the purpose of this workshop is just that, to get a better understanding of the Medicare program, who it affects, what the different parts of Medicare are, who is eligible, and what happens when somebody becomes eligible for Medicare, just among the questions that will be answered. And so we're looking forward to that. Before we get started, though, and have introductions, I'd like to give our attention to Jeff Koss. He's going to give us a little bit of information about the Wyoming Primary Care Association.
Good morning to all of you, and welcome to today's event. We are pleased to be hosting this webinar on Medicare and with our presenter, Renee Martinez, with the Centers for Medicare and Medicaid Services. Joe will give a formal introduction in just a moment, but I would like to take this moment and thank her for presenting today. I would also like to acknowledge and thank all of you for your work each and every day with our health center patients. We are hoping that this webinar will be another level of information to help make your jobs a little more easier and more effective. Joe, thanks for bringing us all together today, and I'll give it back to you.
All right, thank you very much. So we've got a small enough group here today, so I'd like for us to just have some introductions. I don't think everybody here knows everybody. In fact, I don't know everybody who's on the call today. So if we could just go ahead and start with introductions. My name is Joe Rivera. I'm a principal consultant with Q&E Services LLC, and I work with the Primary Care Association to provide training and technical assistance and support to health centers on all matters, outreach and enrollment. And so this Medicare is something that Medicare Workshop is something that has been communicated to me as a need or information that the health centers would like. So we're presenting that today, and I'm very happy to be here with you and to be able to be part of this. And so Desa, we'll go ahead and I'll just call on some of you to introduce yourselves because we have such a small group. So Desa, would you like to introduce yourself?
Sure. Good morning. My name is Desa Robertson. I am a navigator with Enroll Wyoming. I'm happy to be here. As I stated earlier, I do events throughout the state, and I get asked questions all the time about Medicare. And I really don't know enough about it I know enough to be dangerous, I'll say. And so I always just give them Nancy's phone number. She's on our staff. And so I don't know, I've given out her number probably half a dozen times or more. And I always say, she's the guru, go to her. So, but I'm excited to be here. Thank you for inviting us.
Thank you. And then Nancy, would you mind introducing yourself, please?
I'm Nancy with Enroll, Wyoming, and I am also a WISHUP volunteer for the state of Wyoming. I've been doing Medicare stuff since 1995. So I'm checking in today to see what I don't know, because I'm sure there's something I don't know.
Thank you very much. We also have, I think, on the call, Cecilia, and I believe that's from the University of Wyoming. Cecilia, would you like to introduce yourself or those in your room?
Hi, my name is Cecilia. I'm a case manager at University of Wyoming Family Medicine. I'm just here to learn more about Medicare. Nice
Great. Welcome. Thank you, Cecilia. And then Keith, would you mind introducing yourself? Keith is with the Primary Care Association.
Yes, hi everybody. I'm Keith Rivas. I am the communications manager for the Wyoming Primary Care Association. Good to be with you guys.
Thank you, Keith. And I think we've still got Devin Spencer. If you would, I think everybody knows you, Devin, but go ahead.
Yeah, so I'm Devin. I'm the training manager for the PCA. So yeah, I've been working closely with Joe on bringing you these type of webinars and workshops to further your knowledge in that.
Thank you very much, Keith. Devin, I'm sorry. Okay, great. So we're gonna go ahead and just go right into this workshop. We'll give our attention now to Renee Martinez, who is with the Centers for Medicare and Medicaid Services, and take it away, Renee. We're really looking forward to this.
Yeah, thank you all so much. I'm so excited to be here, and I'm actually really glad that it's a smaller crowd because I really love the interactive conversations. And so thank you for being here. Nancy, I don't know if I'm going to provide you any more information, any information that you don't know. So Medicare, as I'm sure that Nancy knows, or any of you that have had any run-ins with Medicare, it's a very, very complicated program. So today I'm going to go over just the basics. I did put my contact information in the chat. Please feel free, if you guys have a complicated scenario, or if you have more of an in-depth question, please feel free to shoot me an email. And if I don't know the answer, I will certainly get you the answer. I am with the Centers for Medicare and Medicaid Services. I'm with the Denver Regional Office, and Wyoming falls in one of our 6 states that we do. There's 3 of us that actually do outreach to a 6-state region. Wyoming is my state. It always has been for almost actually a decade. So I've been with CMS for about a decade, and I've worked in both the outreach field. So, Medicare is kind of our baby, but I've also worked in the policy field with, I don't know if you guys are familiar with CISIO, the Centers for Consumer Information and Information Oversight. So more in the marketplace realm with policy and that kind of stuff. So I have, I've been around. I know enough to be dangerous as well, as Dasa said. So if you guys have any questions, feel free, like I said, just pop in and feel free to interrupt me. And I'm just going to dive right in and start sharing my screen here. And as I did mention, this is a very basic overview, just because we don't like to throw out too much information. What we find is if we end up doing that, it just ends up overwhelming people. And, we do have our, I will throw out there, our national training program, which Nancy, you were probably familiar with, being part of the Wyoming SHIP, where you can find the information online. We actually hold, hopefully it will again be in person very, very soon, but we used to do annual training for those who, they're called Medicare Train the Trainer. So our SHIP providers or state health insurance assistance programs were always there for those trainings, and they're very much more in depth. But usually when we come out and we do basic understanding Medicare, we don't get too much in the weeds because there's usually always a caveat to a situation or another. So I'm just going to jump right in here. All right. Great. So what is Medicare? Just very, very basic information. Medicare is health insurance for 3 groups of people. So what you will generally find is it is for those individuals that are 65 and older, but you can be under 65 and still get Medicare with certain disabilities. And then you could be at any age with end-stage renal disease. It is administered by CMS. Centers for Medicare and Medicaid Services, what we find is the most surprising to Medicare, or those to be getting ready to age into Medicare, is that they don't know that's actually administered by the Social Security Administration. But it is. There are 4 parts to the Medicare program. There's Part A, which is your hospital insurance, and Part B, which is your medical insurance. And those 2 together we call Original Medicare. I'm going to skip on over to Part D, which is our Medicare prescription drug coverage. So normally, and we'll talk more about this, but normally those who get Original Medicare have Part A, Part B, and then they have a tag-along Part D plan that provides their prescription drug coverage. Another completely different way to get Medicare is through our Medicare Advantage plans, which you're still getting Part A and Part B. You're just getting it in a little bit of a different way. You're getting it through a private insurance provider, and we're going to talk more about that. But so there are different ways to get Medicare, which, you know, this is where it gets kind of confusing for people, and I'll dive into that further. But it's A, B, C, and D pretty much. And I like to call A and B kind of your a la carte options. I don't know, food reference, but Part A, Part B, Part D, a la carte, and then Part C is kind of your buffet option. You kind of have all you can get, and sometimes a little bit more there. So enrolling in Medicare. So if you're already getting Social Security benefits, then you're going to be automatically enrolled 3 months before your 65th birthday. I think that the running joke, honestly, within CMS is it's hard to not know when you're becoming Medicare eligible, whether you're getting Social Security benefits or not, just because of all the advertisements in the mail that you get. So the joke is, oh, you'd almost have to be like hiding under a rock. But what we're finding is, and it's not hard to believe, you get so much junk mail, and, you know, beneficiaries end up just throwing it away, that, you know, sometimes they'll miss that manila welcome to Medicare packet. So, but you will be automatically enrolled. Now, if individuals are not automatically enrolled because maybe they're still working, then that's a whole different thing. They'll actually have to sign up through the Social Security Administration if that's the case. And we're going to talk about when you would actually do that. So the initial enrollment period in Medicare, it's a 7-month period. And this again is for, you know, individuals who are not being automatically enrolled. So they would need to contact SSA and enroll themselves. So our initial enrollment period happens one time. It's a 7-month period, and that begins 3 months before the month of your 65th birthday, and then the month of your 65th birthday, and then 3 months after. So you get a lot of time there to actually sign up for the Medicare program. We do have, this mentions one special enrollment period here, which is an 8-month period for signing up for Part B, which I will dive into more, but we actually have, there's a lot of different special enrollment periods that we do have. So this is where it gets kind of complicated. If you guys are curious, if you run into somebody, then you're like, oh, I'm super curious, you know, you missed your initial enrollment period, maybe you fall into one of these special enrollment periods, that could entirely be the case. The biggest special enrollment period, which, you know, gives a person who missed that IEP up above the opportunity to enroll into Medicare. Our biggest one is for what we usually deem as for Part B, which is an 8-month period that you have after you lose your employer-based coverage, whether that's, you know, of your own doing or not. And then if you miss both of those, then we have our general enrollment period, which is January 1st to March 31st each year. The bummer with your general enrollment period, if a beneficiary actually, you know, misses the 2 above opportunities, is, well, one, their coverage doesn't become effective until July, right? So what's going to happen between the time they sign up and July 1st? And then also Medicare has penalties for Part B and for Part D. So if they don't sign up when they should have signed up, and they don't qualify for one of those special enrollment periods, it's entirely possible that they're going to run into a situation where there's a penalty associated with, maybe their Part B and their Part D. And, we'll talk about this, but, if you're looking at a Part B penalty or some of these penalties, I mean, they don't ever go away. So it's important that if you run into somebody who has Medicare questions or, is like, well, maybe is on the marketplace or the exchange, whatever word you prefer, and then is aging into Medicare and has questions, very, very important to do their research or to get them in contact with somebody like Nancy or somebody else in the Wyoming SHIP office that it works with people on the ground in that state, because it can vary by state, but in that state as soon as possible so that they can give them the most in-depth information. So, and one of the big reasons that as you'll find that, most people will go ahead and they'll enroll in Medicare Part A because most people get Part A premium free, whether it's through themselves or through their spouse. So most people will go ahead and sign up for Part A as soon as they become eligible. And the Social Security Administration will tell them if they get Part A premium free, but most people do qualify for that. But some people choose to delay getting their Part B, their Medicare, or their medical insurance coverage because they're already getting coverage through their employer or through their spouse's employer. So there's no need for them to get that coverage as of yet. Now, it is very, very important, though, that if somebody is toggling with that choice, do I delay my Part B or should I go ahead and take it, that they actually talk to the employer benefits administrator, because there's certain instances where, like let's say, for example, an employer has less than 20 employees, their coverage that they're providing may not qualify for them to put off taking Part B. And most of the time it does. Most of the time you can stick with you or your spouse's employer coverage and enroll when you retire, and you have that 8-month special enrollment period. But it's always, always, always important to check and just to make sure. We always encourage people to talk with benefits administrator because it's very important. So Medicare is actually primary when it's your only insurance, of course, right? I always think that, well, it's pretty funny, but if the only other source of coverage is Medigap, Medicaid, retiree benefits, veterans benefits, and TRICARE for life, that's a biggie. Medicare is going to be primary there, and not a lot of people, especially veterans or TRICARE for life beneficiaries that I run into actually know that. So that's very, very important to note. COBRA coverage works with Medicare in a very special way as well. So that's one of those caveats there. Very important for people to look up if they have COBRA, how specifically COBRA works with Medicare as well.
Renee?
And Medicare, yeah.
Renee, I'm sorry if I could just interrupt for a second.
Yep.
I neglected to mention this in the introduction that if anybody has any questions about any of what Renee is presenting today or not presenting, if you have other questions, please, you have a couple of choices, put them in the chat. We'll take time. Renee will be stopping from time to time for questions, but she's also allowing, since we're such a small group, if you would like to just unmute and ask a question while she's presenting too, she's okay with that. But there will be opportunities for questions throughout this presentation. But so you can do either chat or just unmute yourself. So sorry, I didn't mean to interrupt, Renee.
Oh no, you're fine. Yeah, please, if you have any questions, I don't want you to forget where your questions are. So yeah, stick them in the chat or totally interrupt me. Like I said, Medicare in itself is a really, really complicated program. And although we try to break it down as much as possible, it's very robust. And there's a lot of, I don't want to say loopholes or caveats, but there's a lot of, what ifs and, or, what about this situation? And everybody's situation can be different. So we're not going over everybody's situation, just a very, very basic level. But if you have those specific questions, please feel free to just shout them out there. And Joe, if you could actually read anything that pops up in the chat, that would be great.
Yes, I have one
me.
right now.
Great.
Yeah, so this is regarding veterans. So the question is, how does Medicare work for veterans when they have TRICARE for life?
Yeah, so Medicare actually, it's interesting because when it's an interesting question. I can get you guys more specific information on that. But as you can see, Medicare is going to be primary when somebody has TRICARE for life. But if you have somebody, like I'm prior military myself, or you have somebody that actually retires from the military, or even just gets out earlier, there are different options there. Like if I'm a veteran, I have the option to extend my healthcare coverage, right? If I want to, that's going to work entirely different with Medicare than TRICARE for life does. So it can get to be a very, very complicated program, or parts of the program. I can get you guys, and let me make myself a note here, or Joe, if you could actually, and then send it to me. I have some great publications for you guys. If you find that you run into beneficiaries where they're like, well, I have TRICARE for life, I don't need Medicare, or I have questions around, like, well, who do I bill first? I have some really, really good publications for you guys to have on hand that you can be able to either pass out or reference, that can help you with that, because it's really, really complicated. It depends on what you're talking about, honestly. Because what service are you talking about, but in the most case, as you'll see, Medicare is primary when somebody has TRICARE for life. But I mean, I present to many like the Air Force Base here in Colorado, or just many veterans groups, and it can be very, very complicated. So I will get you guys some publications on those if that's something that you guys are interested in. Any other questions?
That's
Okay.
all in the chat for now, Renee. Thank
Yeah.
you very much. And I've made a note on that to remind you,
Great.
send you an email on that. So thank you.
Yeah, I will say that, the biggest groups of people that we find that have questions, and to where it gets a little bit complicated, are veterans, and then also those with COBRA coverage, and those with the railroad board. Oh, I see. Well, I'm seeing 6, 7 now, went to 8 in the chat. Any other questions that popped up, Joe?
Looks like you're on mute there, Joe.
Sorry about that. So Cecilia says, please send me an email. And let's see. Okay, I lost it. They're just asking for that information.
Okay, yeah, and thank you
that.
guys for putting in your contact information, so I can actually reach out to you directly, and I'll include Joe in case he wants to distribute it further. But I will get you guys that information. And like I said, if you want me to break it down for railroad retiree, the railroad board, COBRA, they all work with Medicare a little bit differently, so it can get pretty complicated. It's not your general population, but I'm sure you guys run into beneficiaries or those that are aging in or that qualify through disability that have those questions.
And we do have a question too about Native Americans. How does Medicare apply or impact Native American communities?
So IHS, that is another group that is very, very complicated. As you guys probably know, when it comes to Marketplace and Indian Health Services, or those that are related tribally, there's a lot of great benefits that are provided. It's the same thing with Medicare. IHS is very, we actually let me put it this way: we have an entire branch that is dedicated to the Indian Health Service and how they work with Medicare. So I will get you guys those contacts. I'm just going to write that down here. I will get you guys those contacts as well, in case you do run into anybody that maybe has a question on how Medicare works with Indian Health Service, and those that may qualify for some really good benefits through Medicare as well. So that you guys will have those on hand. I actually have, and they won't mind. I'll just throw their names and email addresses out there to you guys, and they won't mind. They love helping out people who are helping out beneficiaries. Is that all we got, Joe, for now? Okay.
That's all we
I'm
got.
sure there's going to be more questions. So this is just the beginning of it. So we haven't even gotten to the nuts and bolts yet. But yeah, those specific groups, those are great questions. Those specific groups work with Medicare in very special ways. And I don't want to not do it justice because it's very complicated. So I will refer you guys out for those questions. So we talked about when Medicare is primary, when Medicare is secondary, and we've discussed this a little bit. So if someone is 65 and still working and they have an employer group health coverage that has 20 more employees, but let's say if they went ahead and took Part B, Medicare is going to be secondary though in that case. For disability, if their employer group has 100 more employees or ESRD any size after the initial 30 months, ESRD can get pretty complicated as well. Medicare is secondary to non-employer group health coverage providers for workers' compensation, the Black Lung Program, and no fault liability insurance, which if you guys are interested in that, more than happy to provide more information on that. Read publications. And our publications, they do actually, most of them are updated annually. And I'm going to give you guys a really good website to check out. I think I've been on here before and kind of talked about it, but we do actually have a product ordering website that is absolutely free to you guys. And there are tons of publications out there that you can get shipped directly to you at no cost, whether that's in bulk or maybe you just want one or two of them. And a lot of them you can find in electronic form. But if you're one of those people that, likes to hand out a publication or, likes to say, hey, read this, has some really good information on it, you can actually order that in bulk to yourself so that you can be able to distribute that to people who may have questions as well. And then as Nancy already mentioned, she's part of the Wyoming SHIP. So Wyoming SHIP, which I talked a little bit about, but they're actually grantees to provide, in case you don't know what Wyoming SHIP does, grantees that actually provide non-biased Medicare advice to beneficiaries, which is just instrumental. I remember doing a media interview with, I think it was Casper Tribune, and I was just heartbroken because the interviewer was telling me that his mother paid $500 to get Medicare advice from, it was probably an agent or broker. And I almost hate to be that person to say, oh, she could have got that for free. But, there are people out there who charge for that information, and they charge a lot. And, those sometimes you get, especially beneficiaries who aging into Medicare, that it's so much information that it almost just, they block it out. They don't want to even go there. So they just hire somebody, and there's all this free help that's out there. So if Nancy's a part of the Wyoming SHIP, I'm sure she has a contact information. I have Wyoming SHIP contact information I'll be distributing. And what's great about the SHIP is they're very state specific. So I'm sure Nancy can tell you, especially when we start talking about those beneficiaries that qualify for both Medicaid and Medicare, those that are what we call duly eligible. There are states, because that's Medicaid, and Medicaid is a state and federal partnership. The programs can run a little bit differently, especially when it comes to income thresholds and stuff like that. So the Wyoming SHIP has the very specific, they're really boots on the ground. It has that specific information because they've worked with those that are duly eligible or those that are trying to get Medicaid and Medicare at the same time because it pays for most of their out-of-pocket costs. So I do want to put a plug in for Nancy there, and for the Wyoming SHIP, I will get you that information as well. All right. So without saying any numbers, move up in the chat here. So I want to just move on to, we talked about the different parts of Medicare. So Part A, Part B, Part, C, which is kind of your buffet, or, and then Part D, which goes with original Medicare. And I did mention that most people for Part A, which is that hospital insurance, actually qualify for Part A premium free. And that's if they've paid FICA taxes for at least 10 years. They can actually get Part A premium free through their spouse as well. If they don't qualify for Medicare Part A free, SSA is going to let them know that when they go to enroll. And like I mentioned, there are different parts of Medicare, like Part B and Part D, that have penalties associated with it if you don't sign up when you're first eligible. So in Part A, and we don't actually talk about that. Don't talk about this that much because most people qualify for it free, but there may be a penalty that's associated with that. So it's always good for people to do the research and see, hey, do I get it for free or not? So
Renee,
yes.
I'm sorry. I have a question about Part A, the
Yes.
premiums. So I have in the past worked a lot with immigrants, and I'm sure the health centers in Wyoming have this situation come up too, where immigrants who are maybe they're legal permanent residents, but they haven't been working for that they don't have those 40 quarters paid into Medicare. And so the only option they really have if they're going to have coverage is going to be purchasing that. So I saw two figures there, 471 and 259. So I mean, is the premium actually prorated based on what they have paid in?
Yes.
Is that what that is?
Yeah, and that's actually why SSA will be able to tell them, like, okay, well, what do we have on record for you? And what do we have on record for your spouse? Because being able to qualify through the spouse is also great. And then also I would throw out their Medicaid programs for those that don't. For those that don't qualify for getting, Part A premium free. Like I said, that sometimes those can be, as we know, Wyoming has an expanded Medicaid. So, I mean, it can get very complicated, but that's why Wyoming SHIP, they usually know what, like right off the top of their head, what the Medicaid income thresholds are for the different programs, because there are different programs, Quimby, Slimby, sometimes they'll pay for the Part B, out of pocket, Part B costs that you pay monthly to get Part B. And so I would throw that out there as another resource. Nancy, can you think off the top of your head what another resource might be for immigrants that don't have the 40 quarters in?
I can't think of any right off the top of my head. I know we had a woman here in town who had worked for a very prominent person who did not pay into her Medicare, but she was able to get the coverage because she qualified for Medicaid.
Oh yeah. Okay. Yeah. Joe, that would be my first look, especially if you're talking for somebody who might be low income, low resources, is to for them to look into Medicaid to try and get the rest of that paid. Because as I'm going to talk about here in a little bit, those that qualify for both most of the time see very little out-of-pocket costs.
Okay, great. Thank you for that. And kind of related to this, I don't want to get too far in the weeds of this with immigration, but some legal permanent residents have a sponsor whose income is counted for some programs, depending on the program. But that should not affect their ability to purchase that Part A or Part B if they don't have the 40 quarters paid in. Is that correct?
Yeah, and I've actually never ran into that question before, Joe. So that would be great. That would be a great question for me to send up and get a response to. If you just put that in an email to me, and I'll find. I don't want to say one way or the other there because I'm not sure.
Renee?
I mean, I don't see why it would, but is that Nancy?
The other thing that I've heard, and I want to just verify that it's true, that Medicare Part A does not pay for observation if you're in the hospital, but they will pay for treatment, correct?
So yeah, and we're gonna get in, yeah, Nancy, that's a really
Okay.
good point. I'm gonna talk about that. Observation status versus inpatient status is one of the biggest hurdles that we run into with beneficiaries understanding their Part A coverages. So yeah, if they're in observation status, Medicare is gonna pay entirely different than if somebody is an inpatient. But where you run into the issue is most Medicare beneficiaries that we're finding have these issues, they don't know to ask the question, right? If you're sitting in a hospital bed for 3 days, you automatically assume that you are an inpatient in the hospital. You don't assume that, oh, you're still in observation status. So, and yeah, great, Nancy, thanks for bringing that up. That is something that I usually get on my soapbox about when we start talking about what Part A actually pays for and what it doesn't pay for, or what it may pay for, but not as well. As if you're actually admitted, you got that doctor's note saying that, hey, you need to actually be an inpatient in the hospital. You guys are asking some really, really good questions. Any other ones?
No other questions in the chat either.
Okay, great. All right, I'm going to move on. All right, and I will get in depth, Nancy, on what Part A does pay for. So I hope that does help. It's coming up here in a couple slides. For Part B, paying the Part B premium. So most people will pay the $148.50 every single month for Part B. That could be higher depending on what they filed with the IRS 2 years ago. So, and that's something that can be appealed depending on the situation, but most people pay the 140, we call that IRMA, the little bit of extra that gets tacked on to that 148.50. And we do run into people that have a lot of questions about that. So 148.50 is the general Part B premium. And what we will, as we've kind of already brought up, those that qualify for Medicaid, depending on what program they qualify, so they have both Medicaid and Medicare, they can get that Part B, that 148.50 paid for. So that's a really good thing. Just keep that in mind. Normally that 148.50 is deducted from Social Security benefit payments. If it's not, though, it's actually billed every 3 months. And they can contact the Social Security Administration about premiums. And we are going to talk about what Part B specifically covers as well. For the Part B premium, when somebody doesn't enroll in Part B when they should at first, then there could be a penalty. Now, what gets them out of that penalty? Of course, as we kind of already mentioned, if they're still working and their employer or their spouse's employer provides coverage, health insurance coverage that, there's over 20 employees and the benefit administrator says, yes, we do qualify for that, creditable coverage, then they don't have to get Part B right away. But if they don't get Part B and they don't have the coverage, or if they lose that employer coverage and they miss that special enrollment period that we kind of mentioned that was like 8 months long. So, if somebody loses employer coverage, then they have that 8 months to get Part B. But if they don't do it during that time, then they've missed the 3 periods we've talked about. They've missed the initial enrollment period. They've missed that big Part B special enrollment period. So they can't sign up for it until the general enrollment period, which is that January through March. But again, the big downfall with that is their coverage is not going to start until July. And then they could potentially, depending on how long they've waited, how long it's been, they're going to be looking at a penalty. And as you can see on the note here, that penalty is for as long as they have Part B. So it doesn't go away. All right. So I kind of made mention to this in the beginning to kind of help, once we got to this slide, kind of explain a little bit better. So there was parts of Medicare, A, B, C, and D. And as I mentioned, A and B and D, which is your prescription drug medication or coverage, normally go together, and that's called original Medicare. Tacking on to that is Medigap policies, which we're going to talk about. And then the other route they can go, if they don't want original Medicare, is they can get a Medicare Advantage plan, also known as Part C. Now, your Medicare Advantage plans, really, you're getting Part A and Part B and Part D, and even some extra benefits like silver sneakers, or there's all sorts of things that private insurance companies will throw in there, but they're getting it in that package. Now, the difference there, original Medicare, you can go anywhere within the US that accepts Medicare, right? So you're not looking at an HMO or looking at a PPO, whereas if they go the Medicare Advantage route, they're going through that private insurance company. So they're going through, and I'm just throwing this out there, not Wyoming specific, but they're going through Kaiser or United Healthcare, Blue Cross Blue Shield, right? And a lot of times, like I said, they'll throw in those extra benefits, maybe rides to the doctor's office and back, gym memberships, and things like that. Was there another question that popped up in there, Joe?
No, that's
Okay.
so I asked Devin to release the evaluation. So I just wanted to just say real quick that there's an evaluation for this workshop. And so if you have to leave a little bit early, it's okay. Please click on that evaluation, take that. It's going to be very, very helpful for providing, knowing how we can improve these workshops or the content that the PCA provides to health centers. So please, we ask that you don't miss taking that evaluation before you leave, even if you have to leave a little early. So thank you for that.
Oh, thank you. Oh, now, are there any questions between these two? I am going to talk specifically about what original Medicare is and what Medicare Advantage is, but are there any questions kind of up front in what you guys have run into? I'll tell you, one of the biggies I can throw out there is people have like, do I have to still pay the Part B premium if I have a Medicare Advantage plan? Yes. Will sometimes the Medicare Advantage plans pay that Part B premium for you? Yes. So, I mean, it gets kind of state specific, and it can change every single year as well. So let me know if you guys have any questions. I do want to talk specifically about the difference is there. All right. So for original Medicare, like I said, it's Part A, which is your hospital insurance, Part B, which is your medical insurance, and Part D, you should add if you don't have creditable coverage, which is your prescription drug coverage, and then also Medigap coverage or supplemental coverage, which we're going to discuss as well. But original Medicare, as I mentioned, is run by the federal government. You can see any doctor or hospital that accepts Medicare. You don't need to get that primary care physician referral there. You are going to pay the Part B premium. As I mentioned, Part A is usually free. In Part B, mainly it's 80-20 normally. You have the Part B premium, which we talked about, but in most cases, Medicare is going to pay 80% and the beneficiary is going to be responsible for 20%. You will get the Medicare summary notice that is going to tell you, here are the services provided, here's what Medicare covered, and here's what you were responsible for. Okay, so this always goes longer than I think it will, but it's such good information. So Part A specifically, and I know Nancy was bringing this up. So Part A specifically of Medicare pays for your hospital inpatient care, inpatient being the key word, your skilled nursing facility care, and your home health care and hospice care. Now, your hospital in Part A measures benefits in what we call benefit periods, especially when it comes to hospital and patient care and skilled nursing facility care. So what a beneficiary is going to pay out of pocket is going to depend on what benefit period they're in. Now, benefit period meaning that if a beneficiary goes and is admitted into the hospital or admitted into the most of the cases admitted into skilled nursing facility care, they have to actually be, and they're paying these upfront costs, they're paying deductibles and co-payment or co-insurance, right? Now they have to actually be out of and not have went back into the hospital or SNF within a certain amount of time, 60 days. And if they don't, then once they go back if they have to go back into the hospital, then they're going to have to pay those deductibles and the co-insurance all over again. So for example, Mary gets admitted into the hospital, and she's in the hospital for quite some time. Then she goes in a skilled nursing facility, and up front, depending on what her specific services are, she's going to have to pay a deductible, and she's probably going to have to pay a little bit of coinsurance, depending on where she's going. Now, once she gets out of that skilled nursing facility care, if she has to go back into the hospital for any reason within those 60 days, then she's going to be in the same benefit period. So she is not going to have to pay for those deductibles and coinsurance again. But what happens is if she doesn't go back into the hospital or the skilled nursing facility, and then it's been 60 days, she could potentially be looking at, depending on the reason she's going back in, be looking at paying the deductible and co-insurance again.
Renee, we've got a question in the chat.
Mhm.
And I think you might be getting to this in the next slide or two, but I'll ask it now. The question is from Cecilia is, does Medicare Part A, oh no, I guess it is for this one. Does Medicare Part A also cover things like surgery during an inpatient stay?
Yeah, but that's medical. A lot of times we find that falls under, medical, because you're looking at, okay, are you going to a Medicare, a hospital accepts Medicare? Do the providers or whoever is actually providing the surgery accept Medicare? So a lot of times when you're looking at medical, it's going to fall under Part B, which we're going to talk about. But depending on how everything is broken down, everything is normally always written down on that Medicare summary notice, which is why it is so important for beneficiaries, once they get that back, to take a look and say, okay, well, why didn't Medicare pay for the anesthesiologist? Or why didn't Medicare, why did they only pay this much and not that much? It's very, very important for a person, for example, to look at, were you an inpatient? If you're looking at what Part A is going to pay, not Part B or Part D, but for Part A, what was that beneficiary an inpatient in the hospital? If they went to a skilled nursing facility, Medicare is not going to pay for that unless they've done 3 days as an inpatient in the hospital. So if somebody was sitting in observation status, not officially an inpatient, and then the doctor says, well, we're going to send you to a skilled nursing facility, Medicare is not going to pay as robustly for that skilled nursing facility care as they would have if that beneficiary was an actual inpatient in the hospital. And that can be a pretty complicated situation, but it all breaks down to those little things. And when you're talking about cost, and for home, well, let me just say, for home health care, if somebody is deemed that being home, they need to be homebound, except for circumstances like going to the doctor or going to church, Medicare can actually pay for home health care, and they can also pay for hospice care, which most of the time Medicare is going to pay for most of the costs that are associated with hospice care. And that, as I'm sure most of you know, is when a beneficiary, is deemed 6 months or less to live. Medicare only cares about, CMS only cares about keeping that beneficiary very comfortable. So the only cost that you'll generally see with that is up to $5 per prescription, or, if respite care for whoever's taking care of them, then Medicare will pay for most of that, but there's usually like up to 5% out-of-pocket costs that individuals could be looking at. When it comes to the cost for original Medicare, and like I said, this is in one benefit period. Say somebody goes into, well, it just depends on what they're getting, but for the most part, and I actually wrote this down because it's very specific, for days 1 through 20 of a benefit period. Now, remember I said they have to be out of the hospital or not have to go back into the hospital or skilled nursing facility for over 60 days for a new benefit period to start. But let's say somebody just went into the hospital, they're getting inpatient care, and then they're getting, skilled nursing facility care. The cost that they're going to be looking at when it comes to original Medicare for Part A, days 1 through 20 for each benefit period, generally, and I say generally, I always throw that word out there, is 0 out-of-pocket costs. Days 21 through 100, they're looking at about $185.50 per day. And then days 101 and beyond, their beneficiaries are generally looking at all costs that they'll have to pay. Does it change when they have Medicaid as well? Yes, it does. So all of this stuff is, like I said, is it can be very person specific. For home health care, just to be more specific, I did take notes because I wanted to let you guys know that includes your part-time, your skilled nursing care. It doesn't include for homemaker services, unfortunately. So, beneficiaries can't have somebody go in and provide homemaker services, but, they can get their physical therapy, their occupational therapy, speech language pathology services. All of that is included. And for home health care specifically, it's you're out of pocket for home health care. And then it's just 20% of, if they have any durable medical equipment that the doctor prescribes, that's the only, wheelchair, crutches, things like that. That's the only cost that they're going to see for home health care. Any questions with that? Part A is where we tend to see the most questions. It can be the most robust, but it's where the most confusion actually lies as well. And it's especially, like Nancy brought up, it's with the inpatient status. Okay. Part B is a lot easier. I promise. So for your Part B is actually going to help pay for those physician services or the outpatient medical services. So not inpatient, but when they're still an outpatient, and that includes observation status, right? Because they haven't been admitted, it's going to fall under Part B. For the diagnostic tests, your outpatient therapies, mental health services, all of that is going to fall under Part B. But the biggie that Part B covers that is so great are all the preventative services that are free of charge for beneficiaries to go to. There's no out-of-pocket costs for them. And these are things that we really, really push when we talk to beneficiaries, because a lot of them don't know that they can go and get, breast cancer screening, and they're not looking at out-of-pocket cost. So it's a really great thing. It's something that we definitely push on beneficiaries to let them know, hey, there's a lot of free stuff that you can get with Part B as well. But with that, with all the free stuff that's covered, there is stuff, of course, that is not covered by Part A and Part B. Cosmetic surgery, that's one of the biggies. Dental care, we run into that as a question a lot, and dentures, we run into that as a question as a lot. Your long-term care, hearing aids, beneficiaries get really fired up that Part A and Part B do not cover hearing aids. So, it does pay for quite a bit, and as you can see on the note here, if they have a Medicare Advantage plan, right? So they're not going the original Medicare route, they're going a Medicare Advantage plan through, Kaiser, Blue Cross Blue Shield. Could they? Absolutely. They can throw in these extra things that original Medicare doesn't cover. So along with that original Medicare route, so Part A, Part B, we've talked about Part D, which is your prescription drug plan, which we encourage beneficiaries, if they don't have creditable prescription drug coverage, which is what CMS deems as creditable anyway, they'll need to get that as well. There is an opportunity for individuals to get a Medigap plan along with that original Medicare. You can only get Medigap plan with original Medicare, and you can only have one at a time. And these plans are, they're sold by private insurance companies, and they're really designed to fill in the gaps or the out-of-pocket costs that beneficiaries tend to see. Now, I will send you guys, because each state can be different, and Nancy probably even has this download on her computer, but I do have, the Department of Insurance actually runs the Medigap plan. So I do have the DOI Wyoming guide to Medigap plans that I can send to you guys as well. I used to get up on a soapbox and say, a plan is a plan is a plan. So, generally, your Medigap plans are, I'll show you guys this. Actually, let me jump forward 2 slides here. They are defined by, letters A through F, and you can get different private insurance companies that sell the same plan A, right? But they can actually charge different amounts. for this. And so what we find is that, but they're still getting the same plan A, if that makes sense. So what we find is that Medicare beneficiaries are like, oh, well, I'm going to get a Medigap plan to cover some of these my out-of-pocket costs. And I'm going to get a plan A. I think that's all I need. And let's see, Blue Cross Blue Shield and United Healthcare are both selling a plan A, but United Healthcare's is like $350, right? But Blue Cross Blue Shield's is only $150. Well, I must be getting a more Cadillac plan with a higher, the higher priced plan. And that's not the case. A plan is a plan is a plan, or A is an A is an A. So we do run into that issue a lot. I talked to a lot of beneficiaries about that. And, but like I said, too, each state is different on what they offer and what they actually allow private insurance companies to offer. So I do have that Wyoming specific information that I will get to you. I did want to mention that we did have something kind of different occur, something that changed Medigap as of January 1, 2020. And that is that we no longer offer they're no longer allowed to be offered those Medigap plans that actually pay for the Part B deductible. So, and those are what you'll see is they're, let me jump forward here, Plan C and Plan F, as you can see those. So those that are Medicare eligible after January 1st of 2020 can't get those plans any longer. Now, I threw out the question, right, because I was, I've been in the marketplace policy world for a little bit. So I threw out the question when I came back to doing outreach, like, why in the world? Like, what's the big deal about a Medicare beneficiary getting a plan that pays for their Part B deductible? And the response that I got was, in theory, if the beneficiary has to pay those first few dollars out of pocket, they will take a second to think about, okay, do I really need to go to the doctor, or, am I just, there's no need. So that was a response that I got. Those that, qualified for a Medigap plan prior to January 1st, 2020, they can still get those plans, but anything after January 1st of last year, they're no longer eligible to get. And I will mention that, when it comes to Medigap plans, depending on who you go with or who the state allows to, and what plans the state allows to be offered to beneficiaries, it can be something to definitely take a hard look into, because, Medigap plans, if, they can be looking at pre-existing conditions, there's a lot of different rules. CMS doesn't have oversight of them. The Department of Insurance does. So there's a lot of different rules that are, we don't have as much teeth when it comes to Medigap plans as we do with, like those that offer Part C, our Medicare Advantage plans. Any questions there?
Renee?
Mhm.
Oh, go ahead, Nancy.
There, if people go to Wyoming Seniors Inc., there is a book there that you can either download and print off. It is wonderful, and I wish every state would do this, because I have to deal with my dad sometimes in Michigan. And Wyoming puts out this book that explains Medicare and Medicaid issues, and it has all the plans that are offered in the state listed, what their rating is, what their average cost is, and the telephone numbers of the insurance companies so you can call. It's a
Awesome
wonderful resource.
Can you put that website in the chat for me? Or did you already? Just for everybody else so they can have it to reference. And I'm not sure if it's the same booklet I was actually mentioning, but yeah, there's also a DOI actually puts out as well. And it might be what Nancy's talking about. I haven't can send it to you. There is it's Medigap specific kind of things to think about. Here's what's offered for Wyoming specific, because, it is specific by state, that I can send you guys as well.
Nancy, thank you for putting in a plug for that
Yeah.
publication, and appreciate you putting that in the chat too.
Any other questions? Medigap plans can be a great thing, but for those who don't understand that plan A is a plan A is a plan A, we find beneficiaries who are paying for the same thing $200-300 more for the same plan. So it can be when it gets to us, by that point it can be a pretty complicated situation, and we feel bad for beneficiaries who don't know that there's free services out there that can talk them through what everything means. What is a Medigap? Like, do I even need it? Okay, so we have talked quite a bit about original Medicare route. So A, B, D, and Medigap. So I do want to do a quick plug here. We've kind of talked about this. I've went over all these things, but just as a refresher, if you go the other route, if beneficiaries go the other route, and they're not talking about original Medicare, they want to go with a Medicare Advantage plan. Those are run by private companies. We call them Part C. Sometimes you'll hear it referenced to, and they may have their own network of doctors and hospitals, HMOs, so your Kaiser, or you have your PPOs, your, fee for service. So there's, it could be different networks that are associated that with those, but some beneficiaries don't mind. Some beneficiaries, they don't care if they have to stay within Kaiser, because they're getting that Silver Sneakers benefit and they really enjoy it. So it all depends on what that specific beneficiary's medical needs are, what their preferences are. Some states, and I'm not sure about Wyoming specifically, some states only offer one Medicare Advantage plan. Some states have several. So online, and actually Medicare.gov, the beneficiary can put in, if they don't already have an account, their zip code. They can very, very robust online website that they can go in and see what plans are available for them. So, and it can be different. A person can live across the street and they could live, we've actually seen this, a person can live across the street and go into Medicare.gov and see a completely different rundown of plans that are available to them. So I would always refer them to the website to see specifically. And we've sat down with beneficiaries and went through this, through the whole thing. So many different plans available. It is your buffet version, as I call it. I mean, it's a all-in-one option for a lot of people. Some Medicare Advantage plans will pay the Part B premium for you, but some beneficiaries don't know that that they are getting their Part B premium paid for by their Medicare Advantage plan, but they're paying that Part B premium, and then the additional monthly premium for the Medicare Advantage plan, if there is an additional monthly premium. Sometimes there's some Medicare Advantage plans out there that are $0 per month, and all the beneficiary has to pay is the Part B premium. So, and then you're going to pay, yes.
They cannot have a Medigap policy with Medicare Advantage.
Correct. Yeah, the Medigap policies only work with original Medicare, and you can only have one at a time. So if you run into somebody who's trying to sell someone a Medigap policy and they know that they already have one, give me their information, please, so I can take care of that. Same thing with Medicare Advantage plan. You can only have one Medicare Advantage plan at a time. And Medicare Advantage plans are going to have their own. It's not like original Medicare where it's a set, deductibles and copayment. Each Medicare Advantage plan, whether it's Kaiser or Blue Cross Blue Shield, United Healthcare, they can all have their different deductibles and coinsurance and copayments. It's a lot like when I look at my employer coverage every year, and I have all these different options. Well, who do I want to go with? Because they all have different premiums and deductibles and out-of-pocket costs. Any other questions there? Thank you for that comment, Nancy. I told Joe, I said, there's no way I'm going to go over an hour. But you guys asked such good questions. All right, so Part D we talked about A, B, and C. Part D, made mention to this, is your Medicare prescription drug coverage. So if you have original Medicare, this is going to be tacked on to your original Medicare plan. It is also run by private insurance companies, a lot like the Medicare Advantage plans are. So there's going to be different plans available in different areas. So if somebody has original Medicare, they're going to get A and B, and then they're going to put in their zip code, right, on Medicare.gov to see what Medicare prescription drug plans are available in my area. And then they're going to have to look at, well, what's the premium? What pharmacies are associated with that prescription drug plan? Will my medications be covered as they are currently be covered? Will the out-of-pocket cost be the same? And this is something that they can choose they can choose a new plan every single year. If they have a Medicare Advantage plan, Medicare Advantage plans, as I already mentioned, a lot of times that prescription drug coverage is already built in. If individuals do not get their Part D originally, they can be looking at a penalty, and I think I have a slide coming up talking about that. So Part D is another big one of those that, some people, they think that they have a prescription drug card and that qualifies them, that they don't need to get Part D, and it doesn't. The only thing that gets people out of not paying a penalty for Part D when they do get it, once they realize that this prescription drug card is not really covering as much as I thought it would, and my drugs are getting more and more expensive, so I need to get a Part D plan. Well, they're flabbergasted when they're like, what do you mean? That's not, this card isn't creditable coverage, and it's not. And so we run into that quite a bit, and you will see here, there is, as like Part D, that late enrollment penalty slide's coming up, but as there is in Part B, you have your standard premium, and then sometimes people will pay a little bit extra because of what was filed from the IRS, 2 years ago. So if they had the higher income that was deemed higher income 2 years ago, they could be looking at paying a little bit more for Part D, just like Part B. And as I mentioned, that can actually be appealed as well. Everybody has different circumstances going on, and what I was making 2 years ago may have been totally not what was going on in what I'm making right now, and something could have occurred in those 2 years to where it's like, I cannot pay this extra over the top of my Part D premium. There's a little bit more information on the penalty. It's technically an additional 1% of your base beneficiary premium, which sounds very, very complicated. But the Part D premium, so for Part B, the penalty is you have to go if you don't sign up for Part B, right? You have to actually go a full 12-month period before you're going to see a Part B penalty. The Part D is a little bit different. It's for each month that you should have had it and you didn't, you're going to see that penalty. So Part D in a lot of ways can actually surprise our beneficiaries a lot more when it comes to penalties that tend to pop up that they didn't realize that they were going to be looking at. And is the only way that they get out of not grabbing that prescription drug plan when they should have is if they have, like I said, that creditable coverage, or they get extra help, which is one of the Medicaid programs, is something that they can get with a Medicaid or dually eligible. Then they can get it that way too. A lot of times you get your drug, sometimes you get those premiums paid for with the different Medicaid programs, depending on what you actually qualify for, what the state allows and what you qualify for when it comes to income and resources, if the state is looking at resources. So I'm going to send this to you guys because it can be pretty complicated. This is my second to last slide. My next slide is just a resource slide. I wanted to throw this out there to you guys. As I mentioned in the very, very beginning, we don't only have one special enrollment period. We don't only have that, hey, I don't have employer coverage anymore. Now I need to get Part B. Well, you have 8 months. That's a special enrollment period. We actually have other special enrollment periods as well. We have our 5-star plan special enrollment period. We have our low performing plan special enrollment period. You know, if you're in a plan that's low performing and you want to switch out of that, sometimes we give you that opportunity. If you want to switch to a 5-star plan, one of the benefits that we actually give our Medicare Advantage plans is, hey, if you qualify through us, and because we take beneficiary ratings, we take provider ratings for all of our Medicare Advantage plans. There's a pretty robust rating system. If we deem you 5 stars, we're going to give beneficiaries the opportunity to switch with you when they want to. So, I mean, these can change. Most time you don't see much change with them though, but we have more than one. And that's what I wanted to point out to you guys the most is that, you know, or if somebody is in a Medicare Advantage plan, if someone switches to original Medicare, just throwing this out there, let's say they have original Medicare and they switch to a Medicare Advantage plan and they hate it. They're like, oh, I want to go back to original Medicare. That's a different special enrollment period that we have. So we have more than one. So I'm going to send these to you guys so you have it on hand. We have publications out there as well that kind of break it down to where, you know, a beneficiary can look at it and understand it easily. But I just want to throw that out there. Some people don't know
Renee,
that.
I have another question. This has come up in the last 2 weeks, which I've not had before.
Okay.
Person goes on Medicare because their disability after 2 years, they're enrolled in Medicare and then they get better. Do they get kicked off Medicare?
That I don't know the answer to that, Nancy. I can find the answer to that. I don't know. I would imagine that has something to do with SSA and the Social Security benefits that they get re-disability. I know that it can get tricky, especially like sometimes people with disability go back to work. Even that can get complicated. Shoot me that question, or Joe, if you can, I will find out for you. It's a really good question. I've actually personally never ran into that before.
Yeah, I made a note of that, and just to make sure I'm understanding what Nancy's talking about. So if somebody is under the age of 65 and has been on SSDI for more than 2 years and is on Medicare now, and then now they're no longer on disability, are they disenrolled from Medicare? Did I get that right, Nancy? Okay.
You got it exactly. And it's
Thank you.
happened twice in the past 2 weeks, which
Really?
I've never had it before. Yeah.
Yeah, I haven't ran into
So
that either.
Yeah, I expect one more, you know, because they come in threes.
Yeah, that sounds about right. Yeah, I'll find out for you for sure. And then, yeah, that's really interesting. I would be interested in learning the answer to that myself. But I'm sure you're probably going to get a really complicated response back to that, depending on the personal situation. That wouldn't surprise me. But I'll get you the general answer back. And if you have any more questions, or you want to talk about a beneficiary specifically, you can also send me that information and we can look them up in our system and see what's going on as well.
All right, thanks.
Yeah, absolutely. That's what I'm here for. This last slide is a Medicare resource guide. I have a whole entire Medicare resource presentation that I love to go over as well. I think, Joe, we've already presented that to this group or to some. We have the Medicare New Handbook so that, like I said, we do have that. It's not on here. I'm surprised. So our Medicare publications website, I will get that to you. You can get these publications, the Medicare New Handbook, your Medicare benefits. There are thousands of publications out there. Choosing a Medigap policy, things like that, that you can order free for you, straight to your door, whether it's in bulk or you just want one of them, you can do that. I believe the only caveat is that it cannot be a PO box that it's being delivered to you, but everything else can go to you for free. And I'm going to stop sharing my screen. I haven't been able to see anybody's faces because everybody's been minimized. Are there any other questions that you guys have? I know, like I said, it's very complicated, and what I gave you is super high level. And Nancy, I don't know if I helped you at all. Lisa, do you have any questions?
You did help me quite a bit.
Thank you.
Just some really, really good reminders that, you know, I don't run across every day, but need to know.
Thank you. I really appreciate that.
Renee, I do have a couple of questions. These are my questions, but something that I've never really been 100% clear on is, so when somebody becomes, they're 64, they're going to be 65, at some point they start receiving a lot of mail from Medicare, legitimate stuff from Medicare.
Yeah.
And so just taking as an example, somebody who has paid the 40 quarters into Medicare, over the years. So that Part A is basically automatic, correct? In other words, they don't have to opt in, they don't have to sign anything. They're just going to get it. Is that correct?
Yeah, well, most of that depends, Joe, on if they're already getting Social Security benefits or not. So,
Okay.
I mean, if they're still working past the age of 65, which we find more and more, right? They may not get automatically enrolled. So it's so important for them to go ahead and make that initial contact with SSA. And then at any time after, I mean, the good part is if they get Part A premium free, as soon as they're eligible, really they can enroll anytime. They're not going to be looking at a penalty because they get it premium free anyway.
Okay.
So, I mean, that's the good part.
Yeah, I guess
there's
that's my
Nancy.
question. And that is, when you say enroll, what does that mean? Does that mean for Part A, if they're not working, they're getting Social Security,
Well,
they basically, do they have to take any steps in order to start receiving Part A?
So if they're getting those Social Security or disability benefits, then they don't need to do any action,
Okay.
right? But if they're not, then they do. And and like where we find that is if people are still working, right? If they're
Right.
still working, but hey, why not? What we run into, why not get Part A, even if you're still working? Will it cover anything? If your employer is going to be primary and Medicare is going to be secondary, I can't tell you that. But is there any harm in getting something that's free to you? Just throwing that out there. If you get it free.
That's very helpful. Now for Part B, is that an opt-in or opt-out? So is it automatically, if they're getting Social Security, and is it automatically deducted? Do they have to opt out in order for that not to happen?
So a lot of times what we find is that people will be when they're automatically enrolled, it's in both, right?
Okay.
And if you're already getting those Social Security benefits, then your premium is going to be automatically deducted from that.
Okay.
That's what we find in most cases. Now, do we find other cases? Absolutely. Sometimes people rather be billed every 3 months? Yes. And so they can opt out of that as well.
So someone who is I've had like 75-year-olds who are on Part A and they've never been on Part B, which is crazy, of course. But how did that happen? Did they physically have to just opt out so that money wasn't deducted from their Social Security, and they didn't have to pay for that, I guess?
What we run into, and it absolutely breaks my heart, is that some beneficiaries are like, I don't need Part B. What do I need Part B for? Or I don't need prescription drug coverage. I have this fancy card, right? And then as people get older or life happens, I get hit by a car tomorrow, I have major medical bills, or just anything, any kind of medical insurance need. And then they're finding, oh man, I have to get occupational therapy, or I have to get physical therapy, and I'm paying for this out of pocket. And then they're like, shoot, I need to grab Part B. And it's seriously, if they don't qualify for an SEP, or they don't qualify for some extenuating circumstance where they've been lied to, and they can prove it, or just something that is like really over the top, they're going to be looking at that penalty.
Okay. So generally, once they decide, okay, it's been 10 years or 5 years since I've been without Part B, they have to wait until the next open enrollment in order to get on that.
General enrollment period. Yeah. Like I said, unless they've been working and then stopped working and qualify for that. But yeah, if they're 75, they haven't been working, it's been 10 years, they should have got Part B. I don't even want to know what their Part B premium is going to be once they actually get signed up, because like I said, it's for each 12-month period. And they're going to have it as long as they have Part B. I would definitely encourage them to reach out to the state's Medicaid office as well, if you find somebody that that they run into that.
Okay.
We've had
Sorry,
an instance like that, Joe, where these retirees from a mine here in town were told not to get Medicare B, and now because of Lighthouse Resources bankruptcy, they've lost all their medical care. And so they're looking at 25 years of penalties on Medicare B because were told not to sign up. So I
Wow.
always tell everybody, do it.
Wow. Yeah.
Yeah, definitely. And Nancy, sometimes we can run into situations where they're like, oh, we can prove that we were told, not to do it. Or is it that, or is it a benefits administrator saying, you're good, and then something does happen and now they're in this situation that they can't get out of. And it's really, really heartbreaking.
Wow. Okay. Raquel did post in the chat her appreciation for your presentation today.
Well, thank
Renee.
you.
So thank you, Renee. Thank you, Raquel, for doing that and expressing that and that it was helpful. So, does anybody have any other questions?
Desa, how are you feeling? Are you feeling better, worse?
Much better. This has been really, really informational. I'm appreciated everything. In fact, I think, Nancy, I'm the one who sent those questions to you, those persons to you, because I recognize those questions. So, but yeah, this has been very helpful. Thank you.
Yeah, and we have an appeals process too. And when I know people don't want to go that route, it's an option. So everyone is different. Every single beneficiary has different things that they run into. And, if honestly, in the regional office, we have people who've been here, I call my work dad, my CMS dad, who taught me everything. That's one of his favorite things to do, is to specifically look up beneficiary information. What happened here? Like, what went wrong? And can we do anything about it? Because we don't want to see, people become, be 75 and then get Part B and run into something like that.
I've done several appeals there. I don't think they're that difficult. So,
Oh, that's good to hear.
yeah, I
That's
thought it was
really good
pretty
feedback.
easy. And I've won.
I'm sure you have, Nancy. I'm sure you have that aura. I got it. Yeah. I so appreciate being here, and I love the conversation. You guys asked some excellent questions. This is honestly, I miss doing outreach when I went to go do all that boring policy work. So I'm so happy to be back, and I'm your guys' Wyoming contact. So any questions, any events, any partners that you guys run into that need help with Medicare, there is the Wyoming SHIP office that is probably going to be able to tell you Wyoming specific stuff off the top of their head. But if you have any policy questions, or if it moves beyond that and the Wyoming SHIP office is busy, as I'm sure that they are, feel free to contact me.
Great. If there are no other questions, I just want to thank you, Renee, so much on behalf of the Primary Care Association for providing this fantastic information. I know I learned quite a bit myself today, and I think this is a kind of content that is really helpful for our health centers and for the community in general. And so I want to thank those from Enroll Wyoming for attending also. And just to let everybody know, the recordings of this workshop will be released fairly soon. And so please share these with those in your organizations, the recording with those in your organization who were not able to attend and who you think might benefit from that. And so with that, anybody else from the Primary Care Association like to say anything before we leave?
Don't have anything specific, but yeah, thank you so much, Renee. That really helps. I learned a lot for sure. So yeah, thank you for your time. We really appreciate you coming on and doing this with us.
Yeah, thank you. Please give my love to Jan. She is just amazing. Like, she's one of my favorite people ever. So
nice. And so we will, as I mentioned, be releasing the recording, but also the slides. And also I'll be following up with